I can start? Okay. So, dear masters, professors, and colleagues, good morning. My name is Sebastien, and I appreciate this opportunity to give this presentation, and thank you all for coming this morning. So, the 6 months I had the pleasure of spending with you went by very quickly, and as a French proverb says, it's at the best of times that we must leave. So, to tell you a bit more about my background and previous experience, I grew up and studied in Paris, the City of Lights, and graduated from the University of Paris-Saclay. And these are some pictures of the 2024 Olympics that took place in Paris. Maybe I start over because Professor O arrived.
It will be on YouTube, sorry.
Okay. So, actually, my journey in plastic surgery began in Busan, in South Korea, where I did an internship at Inje University Hospital as a medical student as part of the IFMSA exchange program. And the plastic surgery department there was specialized in facial bone trauma and breast reconstruction with tram flaps. And it was an incredible experience, and I still have great friends from that time, even though it was a short internship. So when I returned, one idea became clear. I had to become a plastic surgeon. However, the selection process was extremely competitive, with only 7 places for a plastic surgery residency in Paris out of nearly 9,000 medical students. So, actually, France also has a rich history in plastic surgery, and I would like to highlight the inspiring story of Suzanne Noël. She was a pioneer in plastic surgery in France. As the first female plastic surgeon in France at the time, when surgery was almost exclusively male field, she broke new ground. Especially in the development of reconstructive surgery after World War I, she played a key role in developing facial reconstruction techniques, especially helping to refine graft and flap techniques. And also, in the popularization and refinement of cosmetic surgery, she was one of the first to systematize and refine facelift procedures back in the 1920s. And in her book, Plastic Surgery and Its Social Role, published in 1926, she emphasized the importance of facial rejuvenation for patients' psychological well-being. So, I completed my medical training at the University of Paris-Saclay, and here's a picture of my campus. This is one of Europe's leading universities, and it's located near the Versailles Palace. So, on this journey, I was fortunate to have an outstanding mentor, Professor Maurice Mimoun. He was really kind and supportive and an excellent teacher, who was himself awarded the Suzanne Noël Prize for his contributions to plastic surgery. And back in the 80s, he introduced the concept of nutrient flaps for lower extremity salvage. So he's both a microsurgeon and a writer. And his stories about humanitarian missions first inspired me to apply to his department. And his ability to perform pretty much everything from microsurgical replantations to facelifts greatly influenced me. So here are the covers of some of his books. And on the right side, on the left side, the book is entitled The Impossible Limit. So I was trained in 2 renowned Parisian hospitals, St. Hospital and Georges Pompidou European Hospital, which both specialize in trauma and burn care. Here are some pictures. This picture was taken during my first year of residency, and our department usually has 10 to 12 residents. And my training mainly focused on 2 areas of reconstructive surgery, oncological reconstruction after breast cancer and limb sarcomas, and trauma surgery, including salvage flaps for lower extremity and upper extremity replantations. So at one of Paris' busiest trauma centers, I gained extensive experience in managing critical emergencies and took part in many complex reconstructions. This was an example of major arm replantation combined with latissimus dorsi flap. And in addition, as a renowned sarcoma center, it offered me the opportunity to train in complex limb reconstructions, including vascular replacements. And this was an example of large Scarpa sarcoma with a proper double deep flap with one side pedicle and one side 3. We also do a lot of breast reconstructions, microsurgical with deep and PAP flaps, and we're also developing fat grafting. We also take care of major burns as one of the 2 major burn centers in Paris. And also with the development of transgender surgery in Western countries, we're also starting to do some phalloplasties with 3 radial forearm or pedicle ALTs. And occasionally we do some brachial plexus reanimations. This was a case of 3 gracilis. And finally, I was trained in common aesthetic procedures with a focus on facial rejuvenation. So, as a world leader in aesthetic surgery and reconstructive microsurgery, Seoul was the natural place for me to further my training. And I was determined to return at the end of my training. And so I applied to AMC as the most prestigious academic hospital in the country. And I am very grateful for the warm welcome that I received. And you truly made us feel at home. And with Asan's formidable team, I had the opportunity to refine my skills and expand my toolbox. So first, with the extremity and lymphedema team, I got familiar with fin flap harvesting, and I gained a good understanding of perforator to perforator flaps through various limb sarcoma cases. And I have been introduced to lymphatic super microsurgery and got to learn from your major surgical indications. I saw many LVAs, LNVAs, free lymph node transfers using omentum or skip flaps, and even groundbreaking applications in Alzheimer's disease. I had the opportunity to learn from complex cases that push the limits of plastic surgery, combining all previously established techniques, such as this case of combined chest radionecrosis and breast cancer-related lymphedema, which was treated by pedicle omentum flap for the radionecrosis and free omentum lymph node transfer, combined with LVA and liposuction for the lymphedema. And I had the chance to learn from the masters in the field. Video that was actually from Jolie. And I also had the chance to see some very specialized techniques, such as the free joint transfer and corneal neurotization. So with your excellent craniofacial team, I also got to see some fin flaps for ENT applications, such as this double dip for full skull resurfacing. I saw some bone flaps, such as fibular, and even some challenging cases for maxillary reconstructions. I also had a strong interest in facial reanimation, and I learned a lot from your philosophy, such as immediate facial nerve reconstruction after total parotidectomy, using the sterile graft loop and the charging allograft to the buccal branch. I was really impressed by your combined static and dynamic facial reanimation, combining TFL slings and free gracilis and neurotization. Also, Korean facial bone contouring was a major focus of mine, and I got to learn genioplasty, zygomatic reductions, bimaxillary osteotomies. I saw some cases of facial feminization, such as this case of frontal setback. And also I got to learn about Asian rhinoplasty and the different augmentation options with silicone implants, reed grafts, and saw some really interesting nose reconstructions, such as this management of failed rhinoplasty with a free radial forearm for columellar reconstruction. And I also learned from your breast team, especially the lumbar perforator flap, which is very challenging in terms of time efficiency, with the need of harvesting a graft and changing the position. So I saw how you harvest the deep vascular graft and how you prepare it on the side table. And I also saw your robotic assisted mastectomy and reconstructions. And I also became familiar with the latest imaging techniques in plastic surgery, such as the pre-op color duplex ultrasound mapping for flaps and lymphedema. We even had the opportunity to use 2 ultrasound machines simultaneously on certain patients, and also ICG for lymphatic mapping. And last but not least, I had the chance to participate in various research projects and witness the latest research and development in plastic surgery. Particularly, I enjoyed augmented reality applications such as mapping of flap pedicles and identifying bone structures for facial contouring and malformation surgeries. I had the chance to participate in the Simani trial for robotic-assisted microsurgery and supermicro. And I also saw the development of advanced neuromuscular prostheses. So I really feel that we grew together as an international team and working and learning side by side. And just like that, 6 months have passed. So first, I would like to express my deepest gratitude to Professor Hong, who's a legendary microsurgeon, and he was the one who accepted my application at Asan. And it's been a great honor and privilege to be part of his formidable team for these few months. And I would like to equally thank Professor Choi and Professor Oh, with whom I spent a significant amount of time and who always welcomed me into their excellent craniofacial team. And I would like to thank Professor So and Professor Pak for their attentive mentorship and training, and I am truly grateful for their kindness and their willingness to share their knowledge with us. And also, I would like to thank Jingen, who brought our international crew together. And congratulations again on your appointment as professor. You will become one of the new driving forces in Korean plastic surgery. And also, special thanks to Hoyoung for his dedication and kindness, and his passion for haute couture will surely be a real asset. And of course, many thanks to the rest of the team, all the professors, fellows, the residents, especially Joyoung, and it's been a real pleasure working with you all. So I am returning to France with a solid foundation and many new ideas and techniques that I am eager to implement. And to sum up, it was a very meaningful professional experience as well as a transformative life experience. I truly enjoyed living in Seoul. And to all of you, I sincerely look forward to continuing our collaboration in the near future. So there is no man more complete than the one who has traveled extensively and who has changed the shape of his thoughts and life 20 times. Alphonse de Lamartine. So I would like to conclude with some Korean words. 좋은 팀과 함께 할 수 있어서 너무 행복해요. 그리고 항상 도와주셔서 감사합니다. 제가 더 노력할게요. 앞으로 더 좋은 추억 만들어요. 감사합니다. Thank you so much for these 6 months.
Everything we have to do 2 more years of fellowship.
Exactly. Currently, I am a first grade fellow, and usually in France we have 2 years fellowships, mandatory, but at my institution we have 3-year contracts. So it's a bit particular.
So wish you the best, and please remember that this is the beginning of our friendship. So, because as long as you are doing your practice in plastic surgery and reconstructive surgery, you will meet, and there's many chance that we can have time together again. So please remember, and wish you the best once again.
Thank you so much.
Thank you.
Wow, amazing.
감사합니다, 교수님.
Barbier Jean-Sebastien. Thank you.
Oh.
Thank you.
감사합니다.